Hello, everyone. Welcome to our talk, Providing Feedback in Clinical Supervision, Evidence-Based Practices. We will be talking about a few things today. First, we're going to talk about why it's important to include effective feedback in your supervision practices. Then we're going to go through a number of characteristics of effective feedback. And finally, we'll go through a couple of case studies to discuss how to apply effective feedback in different clinical situations. I'll let Louise go ahead and introduce herself.
Yeah, I'm Louise Pinkerton. I'm a specialist in voice and upper airway disorders and faculty at the University of Iowa.
And I am Stacy Robinson. I specialize in pediatric speech and language disorders, and I'm also a faculty member at the University of Iowa. All right, so first let's briefly talk about the importance of feedback. I think everyone could probably say, yes, feedback is important, but we don't always know why it's important. Well, if you look at the literature, the first thing we think of is that feedback is an important step in guiding your supervisee towards both competence and independence. And we can look at this through the framework of Anderson's continuum. So even the first stage in this continuum involves the supervisor providing a lot of evaluation and feedback to the clinician. So the supervisor is very direct and active in that role. And that evaluation and feedback stage eventually helps you transition into the transitional stage, which is a lot more collaborative, and eventually guides your supervisee to self-supervising. So that includes that independence piece. Feedback also provides a way to monitor supervisee performance. This can include things like making sure you document your written feedback so that you can go back and look at it to see how far along the supervisee is in your goals towards competence. It also can just give the supervisee a way to reference feedback in order to make measurable change, which is going to help them improve in their performance. And we also know from the literature that effective feedback is considered a top factor in supervisee's judgment of what makes an effective clinical educator. So not only is it important for building the skills and competence that we expect out of our supervisees, but it also contributes to the supervisee-supervisor relationship by making the supervisee more confident in the supervisor's expertise. All right, so let's go ahead and get into some practical ways that we can provide feedback. And we're going to go through quite a few strategies here. The first thing you want to do, and I kind of started mentioning this already, is you want to create an accepting environment. It's very difficult to receive the amount of feedback that's often required to help a supervisee build their skills if they don't first have a solid, trusting relationship with their supervisor. A great way to start out on a good note is to go ahead and discuss feedback up front. Let the student know or the supervisee know how you typically give feedback. For example, a lot of my feedback is written because my sessions are generally back to back and I don't always have time to verbally debrief with the student. We'll do more verbal debrief in their weekly meetings. And so I let them know that that's typically how I structure it. However, I'm also in my initial meeting with the student going to ask them for input, especially if the student has been supervised before. They hopefully have been engaged enough in the supervision process that they know whether or not they need time to process the session before really going over feedback, or if they need immediate feedback. They might know if they prefer verbal versus written. So by letting them know what to expect from you, but also asking for their input, you're hopefully already building a foundation of trust. It's also really important to normalize mistakes and information gathering as part of the learning process. Especially, we work with graduate students primarily, and as graduate students are first coming into their clinical rotations, they often are expecting their performance in clinic to line up with what their academic performance has looked like, which is often at the top of their class. And in clinic, you often don't start out at the top. You aren't immediately competent and independent. And that's a process. And it continues to be a process as you go into different specialties and then eventually even go into different outplacements. So letting the supervisees understand the process of clinical education and how that might impact what the feedback looks like can again help mitigate any issues down the road. It is also helpful when you're giving verbal feedback to use a non-judgmental speaking tone. This is something that sometimes you might have to practice, or it also can be helpful to just think about the wording of the feedback that you're giving, in order to let the students know that this feedback is not a judgment on them personally, but is rather a way for them to increase their performance, which leads right into our next strategy, which is focusing on the behaviors and not the individual. So when you're providing feedback, you want to describe what the supervisee did and focusing on things that can be continued or changed. So when you're giving positive feedback, highlight things that the supervisee can be intentional about continuing to do. Or when you're providing constructive feedback, give them feedback on something that they can change or can figure out how to change. And a great way to do this is to use I statements when you're providing this kind of feedback. So things like, I noticed that the client did this in response to that prompting. You could try this instead to get a better result. That is, again, focusing completely on the treatment process rather than the individual themselves. If you say things more like, hey, you were really harsh with that client, that can very much be taken as a statement about the supervisee. And they might think, wow, my supervisor thinks I'm harsh, when it's more that you were probably trying to say the way the words you used or the tone you used was harsh. So those are just some tips. And again, this will also help build that trusting relationship that you need in order to have an effective supervisee-supervisor relationship. All right, the next thing you want to make sure to think about is being specific in your feedback. This is an extension of the tip we just talked about before. If you are talking about a person's behavior, then you are going to be required to be much more specific than if you're just talking about a general thing about the supervisee. This really allows you to have clear communication between the supervisor and supervisee, especially if you're providing written feedback. I find it incredibly important to be specific because the supervisee can't always ask you questions right in that moment. So I try to be overly specific when I'm providing written feedback. You want to do this in verbal feedback too, but if there's confusion, there's more of an opportunity for the supervisee to ask questions. You also can include rationale and examples to help support the point you're making. So, for example, if I notice that a student didn't use a visual when working on story grammar with their client, I might say something like, let's include a visual next week because we know from the literature that using visual supports when teaching story grammar is incredibly effective. And I noticed that the client really struggled today. So I'm including that rationale in my feedback. And if I want to further make it specific, and explain why I know the client was struggling, I can also give an example, something like, maybe they used the visual last week. So last week they were able to identify the characters, setting, and problem. And this week they were only able to tell you the characters. So I'm seeing a decrease in their performance. And then specificity also really aligns with supervisee preferences. So we know from different studies that supervisees really appreciate it when supervisors can be highly specific in the feedback they give. So just as some examples, rather than just saying something like, great job today, you can be more specific. You can say, I noted that your client was more engaged when you did this. Or for your supervising and evaluation, you could say you administered this evaluation tool appropriately by whatever action they took that was appropriate. rather than saying just, quickly like, hey, this didn't work, you could say something like, this task was too complex. I could tell this because, and then you could talk about different things the client did that made it too complex. Even in feedback regarding SOAP notes or written work, instead of just saying like, hey, nice work, you could say something like, your document was concise and covered all the main points of your session. So trying to highlight those things that your student did that made it an effective and appropriate clinical note. These are often some of the same recommendations I give to my students when they're working with their clients, is to be specific in the feedback so that the client understands what they're supposed to do. In the same way, we want to be specific with our students or our supervisees so that they understand what's expected of them. Just a few tips on helping you with this. Take notes in the moment. I personally have a difficult time remembering details after something has happened. So I have to write notes down in order to be able to be specific. Otherwise, I do just have more general thoughts about, that session went pretty well, or that session went okay. And I might have trouble giving the student or supervisee more specificity if I don't have notes for myself. I personally have feedback templates that outline my comments by activity or task so that the supervisees have a frame of reference of, if I'm saying something about that they need to improve their prompting hierarchy, they know that I'm talking about this specific skill or this specific task. And I actually we have some handouts that show some of the templates I use for feedback on our poster page that you can reference. You can also use track changes and comments when editing their paperwork. So that helps them see, even if you're changing just small words, they can see what you're changing. And often once I've kind of modeled by just changing the writing of the student, I will then start using comments and I'll try to say like, hey, just like I did last week, can you make this more concise? Or, last week, I've shown you the last couple of weeks of how to change this more colloquial language into more professional clinical language. I want you to try that here. So again, that gives them more opportunities to grow in their independence. And then you can also use goals and standards to help frame your thinking about just the different specific skills that you want them to learn. And that takes us into our next strategy, which is comparing to a standard. So we all have standards that we have to teach our students or our clinical fellows if you're a speech pathologist. We have the 2020 certification standards from ASHA, which we call our CASA standards. And then we also have the CF skills summary. So it's important to review these standards at the start of the supervisory relationship to let your students know what's expected of them in a broad sense during this placement. I often, also tell students based on where they are in their program that the level of independence might be changing based on where they are in their program. So I also try to ensure that they know how much support I expect them to need in order to be meeting the standards at whatever point they are in their program. You also want to set up regular meetings that are dedicated to reviewing standards. We at minimum do midterm and final CASA reviews. We also try to do quarterly reviews with our students so that they have smaller, shorter check-ins. We don't go through the whole CASA form, but we go through the main points of it more frequently during the semester. I also have students that really just appreciate that summative feedback. And so they might ask me for even more frequent reviews of those standards, depending on how they're doing. And then something else that I'm constantly trying to help myself do, but that's still a goal for me, is to reference the standards in daily and weekly feedback as appropriate. So, if a student, one of the CASA standards is implements intervention plans. And so if a student is consistently having difficulty implementing the plan that they put in place, it would be appropriate for me in feedback to say something along the lines of, during this activity, you were, I noticed that you had difficulty with providing instruction and providing appropriate support. Remember that we're working towards you building independence and implementing intervention plans so that it's keeping it in the supervisee's mind as well. You can also consider writing individual goals. So I especially try to do this either at the first quarterly check-in or at midterms with students once they've kind of worked with a client for a little bit. These can be specific to the supervisee or the population setting. So I know some supervisors will go ahead and have goals for their whole team of students based on their population of this is what I want you all to learn specific to my population this semester. You can do this at any point in the supervisory process, and you can continue to check in on them and update or change them as needed. Here I have an example of a self check-in for the student to fill out. So I kind of highlight specific skills from the CASA that are kind of overarching skills. And I ask the students to give like really quick ratings and make comments, and then based on their own self-reflection to write the goals themselves. So this is kind of a guided way that you could help students or supervisees create their own goals, and then you guys can review them together. All right, another strategy is being timely with your feedback. And I want to start out this standard by noting that timeliness is highly dependent on the content of the feedback. So sometimes timely means that you're providing feedback in the moment. I often talk about this with evaluations. So if your student or supervisee is administering a standardized assessment and they are breaking the rules of standardization, they need feedback in the moment in order for you to be able to correctly administer and score that evaluation. So that would be a situation where I would provide that feedback in the moment. For my students who are providing treatment, if I see that, very little instruction is being given and prompting hierarchy isn't being led and the client is really not getting anything out of that treatment activity, that would be another moment where I would provide feedback in that moment rather than waiting till after. Oftentimes, a lot of students and supervisees like to have some feedback immediately after the session. I personally do this by quickly verbally debriefing with the student when I can, but I also provide written feedback in a shared document that they have access to anytime. So they could actually look in the middle of the session if they wanted to and see the feedback I'd given up to that point. So that's how they get immediate feedback when they're working with me. So I think that kind of feedback is usually more appropriate for general statements about a session or about an evaluation time. If there are bigger, more global areas for feedback, I would say those would be more appropriate to discuss during weekly and bi-weekly meetings rather than just immediately after a session. And then at mid and in-placement evaluations, this is almost another level of summative feedback. Maybe you've been talking in your meetings about these issues, and those mid and in-placement evaluations can give more summative or conclusive feedback about how those bigger issues are progressing. Sometimes you really just have limitations to how timely your feedback can be because of the setting you're in or the space that you have. If you don't have a private space to give feedback immediately after, then maybe that's not an option. Also, sometimes the setting, you have back-to-back sessions and you don't have time to debrief after each one. And within those, you just have to be creative sometimes. So maybe you do take written feedback that you give them, or maybe you all agree on one kind of like general question you're going to discuss while you're walking from one place to the other. Again, privacy can be an issue, so you just want to check in with the student or supervisee. Some supervisees are fine with having, a general discussion in a hallway, and some supervisees would prefer to only be in a private space. So that's just, again, something you can check in with them on. And timeliness also depends on the supervisee's learning style, what their preferences are, and their readiness. So I do have some students who, if I interrupt their session in the moment, they completely freeze and don't really know what to do next because I've kind of interrupted their flow of thought. So for those students, I might be less quick to jump in. Other students want that immediate, in the moment feedback because they struggle to be not sure about what they're doing, and they would rather someone come in and provide support. Or some students, again, might prefer to not talk immediately after their session because they like to process what happened before they can really give meaningful reflections. And so they might prefer to do more of your debrief and feedback during your weekly meetings. All right, I believe I'm going to turn it over to Louise now to go over the next portion of our strategies.
Yeah, in the few minutes we have left, we're going to touch on a couple more strategies and then 2 case studies. The first one here is appropriate amount. I struggle with this one because I want to almost download my brain and share it with other people. But if we give people too much, it's absolutely overwhelming. And so choosing a couple of learning targets and giving it in small amounts that are provided frequently are really important. If we could have the next slide, I'll talk about some specific ways that I think about this. So I really like to focus on the learning targets, thinking about the standards, the student goals, our learning objectives, and only choose 1 to 3 items to really delve into. And if I'm going to rank things, certainly there's broad clinical skills, there's voice skills that I need them to develop. But if I have a choice, I'm going to choose something related to metacognition. So how are they thinking about the process of therapy? How are they analyzing and critical thinking and problem solving in the moment? Because those skills are going to be the most generalizable to other contexts. So I really want them to focus on the higher level work as much as possible rather than the details if we can. And so let's go to the next slide. Self-directed learning in this population is really important because we're dealing with advanced adult learners. And in the research on adult learning, we know that ownership is essential, understanding the reasons, self-direction is really important. So often we do self-reflection first, and we want to make sure students in our settings, what we choose to do is have individual goals that are leading what they're doing. So I do that with my team as well. Let's go to the next slide. So one thing that can be done, and again, we have more time to spend with our students than you might as a clinical fellow or with a clinical fellow, but one thing you could do is a self-reflection email at the end of the day. So at the end of the day, the student's given a question or can choose from a series of questions and take their own time to reflect on it and send that to the supervisor. And then that could be something that starts the next day, is checking in on that response that the student had and providing a little bit more shaping of it from the supervisor. Let's go to the next slide. And then this, I think, is essential. We need feedback as well, and so we should request it. Being a supervisor is a never-ending project, and I also find that students bring me interesting articles that they've gotten through their coursework or other settings that I'm not familiar with. It continues that idea of the open and honest environment that we want to develop from the beginning. Not only our student clinicians learners, but I'm a learner also, and that it's a team. And I also think modeling receiving feedback is essential. So how do you accept and listen without defensiveness? So let's go to the next slide. One of the things I do is asking people how they feel when they receive feedback and how it could be presented better. I usually do a midterm online survey. It can be either anonymous or with names. There's value to each. Anonymous means people can say things freely. If they have their names with it, you can directly provide the support that people need. It's much more valuable to be able to make those connections. And I usually check in regularly with students. Is what we're doing working for you? What would you change? And I end most of our meetings with, what else do you need from me, or what else do you need to be successful? A new thing I tried this semester is our Office of Teaching and Learning at the University of Iowa offers sessions where they can send a facilitator to sit with your class when you're not there and do a discussion about how things are going and what would help their learning, what's getting in the way, and then how they are being self-directed learners. I found the information very valuable, and we did our team debrief at a team meeting. The students really appreciated the opportunity mid-semester to take some time and work with these ideas, and they enjoyed working with someone outside of our department. Next slide. So we have 2 case studies for you to think about what you would do in these settings. So let's do the first one. So we're thinking about a clinical fellow. They're in their second segment, so you're in the middle of their process. And in doing a skill inventory, the CF rates themselves as exceeds expectations across the board. The supervisor finds that they meet expectations, and there's actually a few where they don't meet expectations. And the CF has to be at that 2 level across everything by the end of their fellowship. So how would you guide this, maintaining your relationship and helping the client grow? So this is a time where you could pause the video if you'd like, and unpause when you're ready to hear what our answers are. So the first thing we would suggest is establishing what the standards are. So ask the student how they rated themselves. What were their standards? What are examples of how they feel they exceeded those expectations? Then it's about bringing the discussion to, okay, well, what are our industry standards? What does speech language pathology expect? Bringing in, focusing on those behaviors that the student's done, bringing in I statements about what the supervisors observed, what the students' examples were compared to those standards, what the supervisors' examples were compared to those standards. Then discussing, again, how that all meshes. And hopefully the student during this process is going to recognize that they're not quite getting to where they thought they were. You can then make a plan to meet those areas where you're either not meeting the expectations overall, or where the student or the CF wants to get to exceeds expectations. And really taking the time then to go back and going, okay, now that we've reset what our standards are and recalibrated, how would the clinical fellow rate themselves? It'll be important to be clear to the student that their initial ratings didn't meet our professional standards, and not in a mean way or a punitive way or walking in and dropping that down. But we do need to state clearly so people understand and they hear that what they're doing isn't where it needs to be yet. We can also tie it into their goals. If they want to exceed those expectations, again, how do we let them direct their learning to that? Let's go to case study number 2. So this is an outplacement in a school setting. So it's still a graduate student, and in the session they have difficulties across multiple skills. Basically, the only way to manage the session was to walk in and really take over, not do one thing and then have them take over, but run the rest of it. So how do you debrief that and move forward? So again, if you want to pause your video. Okay, so what we think you want to start with is in the immediate aftermath, support the student emotionally, what they need to move on to the next session, what they need to finish their day, and ask them to give themselves a waiting period till they feel like they can calmly reflect on what happened, and they're going to write that and send it to you as a supervisor. And then that can be the guide for the discussion. You can think about where were the gaps that the student identified. Is it in their preparation? Is it their knowledge? Is it their mental resilience? Is it the experiences they've had? And sitting down and reviewing the lesson plan, reviewing your notes, reviewing a video if it's available, giving the student the opportunity to point out what's going on, and then the supervisor can identify the behaviors they saw using the I language and talk through their own thinking process or the metacognitive process of managing the session, and specifically identify what they might have done had they come in earlier, or to guide things to a better place. It's really important to then, whatever the gaps were or difficulties were, create a plan for the student to develop those skills or get those experiences or get that knowledge. And we want the student to feel supported in developing that, so that they feel empowered to solve those problems. Okay, so that's it for our session. Let's move to just the next couple slides. We have some resources posted, a couple other presentations we've done, as well as a podcast, as well as CAPCID and ASHA resources and presentation slides and handouts. We can pop to the next slide. We've got references posted, and then here we have our contact information for social media, and you are welcome to email us at our general speech pathology email at Iowa. Thank you so much for joining us.